Have you ever wondered what a single number on a blood pressure monitor actually means? Most people have no idea, and after the age of 60, that one number matters more than almost anything else you could check about your body. Because here's what cardiologists will tell you. High blood pressure is called the silent killer for one very specific reason. It does its damage quietly, for years without symptoms, until one day it is no longer silent. And there are specific numbers on that monitor that should never ever be ignored. Today we are going to walk through every single one of them, what they mean, why they matter especially for seniors, and the one reading where you don't wait for an appointment, you call 911. Now I want to be honest with you right from the start. This is not going to be one of those videos where someone tells you that a special tea, a breathing technique, or a single supplement will fix your blood pressure, plays some relaxing music and calls it science. I find that kind of content genuinely frustrating because the actual physiology of blood pressure is so much more interesting than that. And honestly, so much more important. What I want to do today is walk you through what is literally happening inside your arteries as you age. The stiffness, the pressure waves, the hormones, the numbers. And then based on all of that, the readings you should never ignore are going to feel completely obvious to you. Not because I said so, but because you'll understand why. That's the kind of knowledge that actually sticks. When you know the reason behind the rule, you never forget the rule. But before we get into the mechanics, stop for a second because there's a piece of conventional wisdom floating around that I need to address head on. It is the single biggest reason seniors ignore their numbers, and you have almost certainly heard it. High blood pressure in older people is just part of normal aging. Your arteries get stiff, your numbers naturally run high, and 150/90 is simply acceptable for your age. That logic has been repeated in living rooms and honestly in some medical offices for decades. And then a landmark clinical trial came along and demolished it. The trial is called SPRINT, and once you hear what it found, the rest of this video is going to click into place. So let's build the case from the ground up, and we will come back to SPRINT in detail a little later. I think you'll find it's worth the wait. Let's start with the mechanics, because the first thing you need to understand is what blood pressure actually is. Every time your heart beats, it pushes a wave of blood into your arteries. The force of that wave, while the heart is actively squeezing, is your systolic pressure. That's the top number. Then the heart relaxes, refills, and the pressure that remains in the arteries between beats is your diastolic pressure. That's the bottom number. Two numbers, one squeeze, one rest. That is the entire system, and once you see it that way, the whole conversation about high blood pressure in seniors becomes much clearer. Now your body manages that pressure with two different systems working on two different time scales. In the short term, blood vessels and hormones adjust the diameter of your arteries moment by moment. In the long term, your kidneys take the lead. They regulate how much sodium and fluid your body holds, and fluid volume is one of the biggest drivers of resting blood pressure. The more volume in the pipes, the higher the pressure inside them. This matters for seniors for a reason we'll come back to, because blood pressure is not one thing, it is the output of a system, and a system, once you understand it, can be read. Here's what happens to that system as you age, and this is the part that explains almost everything. Your arteries are not rigid pipes. They are living, elastic tubes lined by a single layer of cells called the endothelium. That lining produces a signaling molecule called nitric oxide, which tells the artery wall to relax and widen when more blood flow is needed. In a young, healthy artery, that elastic response is fast and smooth. With every heartbeat, the vessel expands slightly, absorbs the wave, and springs back. It is a shock absorber. But over decades, that elastic machinery takes damage. Years of high pressure itself, cholesterol deposits, smoking, diabetes, chronic inflammation, all of it wears on the endothelial lining. The smooth elastic fibers in the artery wall begin to break down and are slowly replaced by stiff connective tissue. A young aorta is flexible, like a well-made garden hose. An aged aorta is closer to a rigid pipe. And when a pipe cannot expand, every heartbeat sends a sharper, taller pressure wave through it. The systolic number climbs. And the aorta, the great vessel leaving your heart, stiffens with age more than any other artery in your body. That single change drives most of the blood pressure problems of later life. This is why high blood pressure in seniors looks so different from high blood pressure in younger people. In a younger person, the problem is usually whole system overpressurization. Both numbers climb together. But in older adults, the most common pattern by far is what cardiologists call isolated systolic hypertension. The top number is high, 130 or above, while the bottom number stays in the normal range and in many cases is actually low. A comprehensive review of the medical literature found that isolated systolic hypertension accounts for around 65% of all high blood pressure cases in people past the age of 60. The most common form of hypertension in older adults across the entire world is that stiff artery pattern, a climbing top number with a normal or even falling bottom number. And that leads to something else most people have never even considered: pulse pressure. Pulse pressure is simply the difference between your systolic and your diastolic number. If your reading is 150/70, your pulse pressure is 80. As arteries stiffen, the systolic climbs and the diastolic tends to stay flat or drift downward, so the gap widens. Cardiologists have found that a very wide pulse pressure is itself a marker of arterial aging and cardiovascular risk, because it is a direct measurement of how much shock absorption your vessels have lost. The two numbers on the monitor are not random digits. The relationship between them tells a story about the actual condition of your arterial walls. Now, there are two numbers for a reason, and you will hear a lot of talk about which one matters more. In older adults, the answer is overwhelmingly the top one. The systolic number is a direct measurement of the pressure your heart has to generate to push blood through a stiffened arterial tree. As the aorta loses its elasticity, the workload of the left ventricle, the heart's main pumping chamber, climbs with it. The heart muscle thickens the way any muscle thickens under a heavier load, and a thickened heart muscle needs more oxygen while working at a mechanical disadvantage. That is the pathway by which years of high systolic pressure quietly remodel the heart itself, and it is a large part of why the top number, on its own, is enough to define stage 1 and stage 2 hypertension in the guidelines. Now let's put a number on how widespread this is, because the scale matters. According to national survey data from the CDC, 71.6% of American adults age 60 and older have hypertension, either a measured high blood pressure or they are currently taking medication for it. More than 7 out of 10 seniors. Across all adults, the CDC reports that nearly half have high blood pressure, and federal data indicate that only about 1 in 4 adults with hypertension actually has it under control. 3 out of every 4 people with this condition in the United States are not at their target. They are carrying a risk they could measure at home in 2 minutes, and most of them either do not know their numbers are off, or do not know what their numbers should be. That is the gap we are closing today. And it matters enormously because cardiologists describe high blood pressure as the leading risk factor for stroke and a major driver of heart failure, coronary artery disease, and a heart rhythm condition called atrial fibrillation. So what are the numbers? Let me give them to you exactly the way the guidelines do, because precision matters here. These categories come from the joint guideline issued by the American Heart Association and the American College of Cardiology, which was updated as recently as 2025. And the categories themselves stayed unchanged because the evidence behind them has only gotten stronger. Normal blood pressure is a systolic reading under 120 and a diastolic reading under 80. That is the target zone. Elevated blood pressure is a systolic of 120 to 129 with a diastolic under 80. This is not hypertension yet, but it is the warning zone. Your arteries are telling you something is changing. Then comes stage 1 hypertension, a systolic of 130 to 139, or a diastolic of 80 to 89, and stage 2 hypertension, a systolic of 140 or higher, or a diastolic of 90 or higher. I want you to notice something about those last two definitions. They use the word or. You do not need both numbers to be high. One high number is enough to move you into the next category, and that is exactly the trap that catches so many seniors because their bottom number is fine, and they assume everything is fine. But the top number, the systolic, is the one that climbs with artery stiffness, and the top number is the one that matters most for stroke risk in older adults. The bottom number can be perfect, while the top number alone is putting you in stage 1 or stage 2 territory. Here is where it gets really interesting. In 2017, when the guidelines lowered these cutoffs, millions of Americans who had been told their blood pressure was fine suddenly discovered they had stage 1 hypertension. And a lot of people assumed this was just a money grab by the medical system. But the reason the experts moved the line is the opposite of cynical. It is based on decades of evidence showing that cardiovascular risk does not suddenly appear at 140. It climbs continuously, starting well below that, and 130 to 109 was where the risk curve started rising steeply enough to justify action. The rule changed because the data changed. And this is where I want to bring in SPRINT, the trial I teased at the beginning. SPRINT stands for the Systolic Blood Pressure Intervention Trial, and it was funded by the National Institutes of Health in the United States. More than 9,000 participants were enrolled across dozens of medical centers, all of them 50 or older with elevated systolic pressure and at least one additional cardiovascular risk factor. They were randomized into two groups. One group was treated to a standard systolic target of under 140.
It's crucial we talk
The other
about
group
this
was
now.
treated intensively to a target of under 120. And the difference in outcomes was so dramatic that the trial was stopped years ahead of schedule because it would have been unethical to continue with the standard group. The intensive group saw roughly a 25% reduction in major cardiovascular events and a 27% reduction in the risk of death from any cause. Let that sink in for a moment. Not a wellness trend. A quarter fewer heart attacks, strokes, and deaths just from lowering the target number. A subsequent analysis from the Journal of the American Geriatric Society specifically looked at the participants aged 80 and older and found the benefits held in the oldest group as well. But there's another layer to SPRINT that is arguably even more important for seniors, and it comes from a follow-up study called SPRINT Mind. The researchers also tested cognitive function in the participants because high blood pressure damages the small blood vessels of the brain, and those tiny vessels are exactly the ones involved in memory and thinking. What they found, published in the Journal of the American Medical Association, was that the intensive group had about a 20% reduction in mild cognitive impairment, the early stage of memory decline that so often precedes dementia. The effect on full dementia did not quite reach statistical significance. The researchers were clear about that. But the effect on mild cognitive impairment was real and measurable, and follow-up research has shown the brain benefits persist for years afterward. If you want a second opinion on SPRINT, there is one, and it is just as strong. It is called the STEP trial, published in the New England Journal of Medicine. STEP enrolled patients aged 60 and older with high blood pressure and compared a systolic target of 110 to under 130 against the standard target of 130 to under 150. The intensive group had fewer strokes and fewer cardiovascular events, and longer follow-up analysis showed roughly an 18% lower risk of cardiovascular events with sustained intensive control. Two major trials, two continents, same conclusion. In older adults, lower pressure,
aging?
managed
Please tell
carefully,
me.
protects the heart. And when I say managed carefully, I want to stress that word because intensive control in these trials always included careful medical monitoring. That is a key part of the story, and we will come back to it. The implications of all of this are enormous, and they have officially changed the rules. The 2025 update to the American Heart Association and American College of Cardiology guideline now explicitly states that the blood pressure goal for most adults is under 130/80, and it specifically recommends a systolic goal of under 130 to reduce the risk of cognitive impairment and dementia. Let me translate that. The cardiology organizations of the United States are now saying that the reason to treat blood pressure is not just the heart, it is the brain. The same pressure that damages your arteries is damaging your memory, and the numbers you ignore are the numbers that determine whether you stay sharp. Now, I mentioned European guidelines earlier, and it is worth a quick note because people often ask why the numbers seem to differ depending on where you live. The European Society of Cardiology, in its 2024 guideline, recommends a systolic treatment target of 120 to 129 for most adults taking medication, but it explicitly carves out an exception for the very old, those over 85, and for people with frailty where a less aggressive target of under 140 may be more appropriate because very low pressures in frail bodies can carry their own risks. I am telling you this for one reason. Blood pressure targets have nuances, they have exceptions, and the right target for one senior is not automatically the right target for another. That is genuinely a conversation for your own doctor. Let me now talk about the number that should make absolutely everyone sit up straight. 180/120. Cardiologists call this a hypertensive crisis. Think about what that number means physically. A reading that high means your heart is pushing against arterial walls that have lost their give, at pressures where the vessel wall is under extreme strain. At that level, the pressure itself can begin to injure organs, the heart, the brain, the kidneys, and the eyes. And the rules for this one are extremely clear. If your blood pressure reaches or exceeds 180/120, that is not a watch and wait situation. If you have any symptoms at all with it, chest pain, shortness of breath, back pain, numbness or weakness, a change in your vision, or difficulty speaking, you call 911. Immediately, those symptoms can mean the pressure is already damaging a vital organ. and emergency care is the only appropriate response. If your blood pressure is above 180 over 120 but you have no symptoms, you do not panic, but you do act. The guideline is to call your healthcare professional right away. And I want to be very clear about what you should not do. Do not ignore it and hope it comes down. Do not take an extra dose of your medication to force it down, because an abrupt crash in blood pressure is itself dangerous, especially for older arteries. And do not sit in a waiting room for hours while your reading stays at crisis level. This is the one number in this entire video where speed genuinely matters. But here's the surprising part of this conversation, and I think it's the part that will shock the most people. Some of the most dangerous blood pressure numbers for seniors are not high at all. They are low. There is a phenomenon called orthostatic hypotension, and it is one of the most underappreciated threats in geriatric health. When you stand up from sitting or lying down, gravity pulls blood into your legs, and your body normally responds within a few seconds by tightening blood vessels and slightly increasing heart rate to push blood back up to your brain. In many older adults, that reflex slows down. The result is a sudden drop in blood pressure upon standing. The medical definition is a fall of at least 20 points in systolic pressure, or at least 10 points in diastolic pressure, within 3 minutes of standing up. And it matters far more than most people realize, because the symptom is usually dizziness or lightheadedness, and dizziness in a senior is how falls happen, and falls are how hip fractures happen. And hip fractures in older adults carry one of the steepest health declines in all of medicine. How common is this? Reviews of the medical literature estimate that orthostatic hypotension is seen in almost a quarter of older adults, nearly 1 in 4, and most of them never mention it to their doctor because they assume lightheadedness when standing is just a normal part of aging. It is not something to shrug off. It is a measurable, addressable problem, and it often becomes more common in people taking blood pressure medication, in people who are dehydrated, and in people with certain chronic conditions. That is exactly why blood pressure treatment in seniors has to be individualized. Too high is dangerous. Too low is also dangerous. And only a doctor who knows your full picture can find the balance. If you do experience that dizzy spell when you stand, the safest response is a simple physical one. Stand up in stages. From lying, go to sitting first. Pause, then stand, and hold on to something until you are steady. That is not medical advice. That is just how you protect your balance in the moment. There are 2 more numbers that deserve your attention, and these are not readings on your monitor. They are patterns hiding inside your readings. The first is called white coat hypertension. For many people, sitting in a medical office raises blood pressure simply because of the anxiety of the setting. The reading in the clinic runs 10, 20, sometimes 30 points higher than their true resting pressure. Studies have found this white coat effect in a meaningful percentage of patients. The second pattern is the opposite, and it is more dangerous. It is called masked hypertension. The clinic reading looks perfectly fine, but the blood pressure at home in real life is high. Masked hypertension is particularly sneaky because it completely evades the medical system. A review in the Journal of the American College of Cardiology found that people with masked hypertension carry a risk roughly double that of people with truly normal pressure, a risk comparable to people with diagnosed sustained hypertension. And masked hypertension becomes more common as arteries age. This is why that single clinic reading, the one you get once a year, is not enough. A single number from a single visit cannot see any of these patterns. It is a snapshot, not a movie. And blood pressure, more than almost any other measurement in medicine, is a movie. The picture only becomes complete when you combine it with measurements from your real life. So what do you do with all of this? The single most practical tool a senior owns is a home blood pressure monitor. And I want to give you the measuring protocol that the American Heart Association recommends, because most people do it wrong. And measuring wrong is almost as dangerous as not measuring at all, because it gives you false confidence in the wrong direction. Sit in a chair with your back supported, both feet flat on the floor, legs uncrossed. Rest your arm on a flat surface so the cuff is at heart level, propping it with a pillow if you need to. The cuff should be snug, not tight, and placed on your bare upper arm, roughly an inch above the crease of your elbow. And here is the part everyone skips. Sit quietly for 5 minutes before you press the button. No talking, no phone, no coffee. 30 minutes before. Empty your bladder first. Take the reading at the same times each day, morning and evening, and take 2 or 3 readings a minute apart and write down the average. Bring that log to your doctor. That single habit transforms a random snapshot into a real signal, and it is the same signal your doctor needs to make good decisions with you. But I want to be honest with you about something before we get to the end. A blood pressure monitor is a measurement tool. It is not a treatment. Lifestyle genuinely matters, and the evidence is not subtle. The American Heart Association notes that cutting sodium to under 2,300 milligrams a day, with an ideal target under 1,500, and following a DASH-style eating pattern, vegetables, fruits, whole grains, legumes, nuts, low-fat dairy, can meaningfully lower pressure, losing about 5% of body weight, which is 9 pounds for a person who weighs 180, can support blood pressure control. Regular activity, limiting alcohol, and managing conditions that drive pressure up, like sleep apnea, diabetes, or thyroid problems, all move the numbers in the right direction. These are real, they are proven, and they compound over time, but they are not a substitute for medical care, and I am not going to pretend otherwise. If your numbers are in stage 1 or stage 2 territory, if you are already on medication, if you have any other health condition, the person to build your plan with is your doctor. Because here is what I genuinely love about this topic. The same thing I love about any good science. The knowledge is yours once you understand it. Nobody can take it away. Your blood pressure is one of the few numbers in medicine you can measure at home in 2 minutes, with almost no training, and it tells you more about your future risk of stroke, heart failure, and cognitive decline than most blood tests you will ever get. 2 numbers, 1 squeeze, 1 rest, and the story they tell about the condition of your arteries is a story you are fully capable of reading. So let me leave you with the practical core, the part to remember. 120/80 is the line where normal ends. 130/80 is where the guidelines now say the conversation about treatment begins, for most adults. 140/90 is full stage 2 hypertension, whether you feel fine or not, because feeling fine is exactly what hypertension does. 180/120 is the emergency line, and a 20-point drop when you stand up is the low number nobody talks about, the one that causes falls. If you take nothing else from this video, write those down, and if any of them describe numbers you have seen on your own monitor, do not ignore them. Make the appointment, bring your home readings, ask the questions. And if you are caring for an older parent or grandparent, ask them the same questions, because the numbers that protect them are the same numbers that protect you. That is not fear, that is information, and information is what turns a silent killer into a manageable condition. If this video helped you understand your blood pressure numbers in a new way, make sure to subscribe to the channel. And if you want, leave a comment telling me which of these numbers surprised you most. I read every single one. Thanks for watching, and I'll see you in the next video.